Hey guys, it's Law here with the Lovely Lifestyle, and I just wanted to give you an update. We just had Lana's surgery on October 3. So her surgery took about 2.5 hours long, and there's no complications, so that was amazing. I loved it. We were checked in, and then we got admitted. Lana got a little gas, and then they put in the IV, and that was it. She got in around 6 o'clock, and with being checked in and all that good stuff, surgery started around 8, and we're basically back into the recovery room by 10:30. So Dr. Witt did an amazing job. So with Lana, she had a soft palate repair and an ectropium. Basically what Dr. Witt did was take an upper piece of the upper eyelid and to put it on the lower eyelid because Lana had that pull because she had that Tessier cleft. So with that, I'm going to tell you how it went post-surgery. So with Lana, it took about an hour for her to wake up post anesthesia. And my biggest advice to mommies out there is be there when your baby wakes up. Because honestly, if they're in the recovery room and they're not with familiar faces, you want to make sure that you're there when they get to open their eyes, especially for Lana, since she had the eyelid piece removed from the top and placed on the bottom. Her eyelids are very swollen shut, and it took about 2 hours for her eyes to open. So on the dot, she was given fentanyl in the recovery room, and then once we got to our room, there was no medications that were ordered on time. Basically, anytime Lana started crying, whimpering, I said, give her the morphine, because I know this surgery was very painful, especially for a palate repair and an ectropium repair. So, moms, if you feel like your baby's not acting the way they are, give them the pain medication. Because personally, the only surgery that I can remember having was my C-section recently, and that was painful. So you can imagine if your palate is fixed. So I'm very, very pro advocate for my baby. If my baby's crying, give her the morphine. So for 24 hours, we gave morphine to Lana every 3 to 4 hours, and that made her pain basically. She was sleepy throughout the whole day, didn't really eat much. So they thought we would get discharged after 24 hours, but I'm not going to take my baby home if she's not eating. That would be more difficult for me if I did take her home after 24 hours and she's dehydrated, then we have to get readmitted to the hospital. So no, if you don't feel like your baby's ready to go home, don't go home. You're already in the hospital. They have monitors, the IV attached to them. Get your baby well, then take them home. So that's my second advice. So 1, keep your babies well medicated, get their pain well controlled, and then 2, make sure your baby's feeding, peeing, and pooping. So overall, we were there for Wednesday, Thursday, and Friday afternoon was when we were discharged. So Lana didn't eat until probably her 3rd day. She looked at her bottle, tried to grab it, and she didn't want it. The doctor's advice was to train Lana on the sippy cups, and every baby's different. I'm going to tell you that right now. Lana hated the sippy cup. Lana hated anything, even the bottle, because it hurt. It hurt, but she was hungry. So at least she was hooked up to the IV, so she got nutrition that way. And then when she started eating her 3rd day, basically we had to give her soft foods. If she wanted her crackers, I would put it in the cookie. I would put the cookie in her formula and make it soft, and she would eat it. And then we weaned her off the morphine on day 2 and started just giving her Tylenol. Another medication that was ordered was Tylenol with hydrocodone. I don't want my daughter to be on that because morphine, Tylenol, that's it. That's my personal preference as a mother and as a nurse practitioner. Give them least opioid addicting medications. And if you do give him the morphine and the hydrocodone with the Tylenol, you're at risk for more constipation. And she's already not eating, so I didn't want to have 3 problems on my plate. So first day morphine, 24 hours. Second day just Tylenol around the clock, every 4 to 6 hours to control her pain. And then by the third day, Lana was eating, peeing, and she pooped twice. So we were able to go home. And now that we're at home, everything's going great. So swelling is still there. And bruising, of course, bruising is definitely going to be there. Bruising is going to be there for about 7 to 14 days, usually the natural lifespan of a bruise. And we have our 1-week follow-up on Friday. So I'll give you guys an update on our post-surgery. And this is surgery number 2 for Lana. And it was her ectropium and her palate repair. And one more thing that I wanted to tell you is a few things that I forgot to bring to the hospital was a neck pillow. Okay, I forgot to bring a neck pillow because I didn't sleep on the bed or the couch. I basically sat with Lana sitting with me on my arms, or she slept with my mom. She hated that crib. Another advice that I have for moms is be the best advocate for your baby. And what I mean by that is your baby needs rest, and if your baby's not resting because they're in pain or they're bothering them with the vital signs, tell them not to take it during that time. If your baby finally fell asleep, then you have the right as a parent to tell the provider, can we please postpone this vital sign to another time? Because I know they have their protocol and all that good stuff, but you could take her pulse, you could take her heart rate, and you could take her temperature, but the blood pressure was really hard for her. It hurt, and she was already in pain here. And if Lana fell asleep, I basically told them, you can't take her blood pressure right now. She's sleeping. You could come back, and I'll call you when she wakes up so you could take her blood pressure. So I understand protocol, but I also understand patient rest and comfort. And my daughter needs her rest. She needs to recover. And if you're waking her up when it's time to do your vital signs, that's not okay with me. So that's another advice I give to mommies. Another thing that I forgot was towels, because the hospital towels are not that soft and they're not that big. And shower slippers. That's another thing I forgot to pack in my bag that I wanted to tell you guys that I really needed. So basically, hopefully, this video can help anyone out there going through what my daughter and I are going through. So thank you so much for watching. This is our Cleft journey together, part 2. Hope you have a fabulous day, and I'll see you next time. Mwah. Bye.